develop a monitoring system for school closings. And so schools that are going to close for a day, a week, however long, have been asked to email or fax or log on to a website to report those school closings. So you'll see in the South, if you see any statistics about how many schools are closed, that's where that information is coming from. Schools are reporting themselves. And so this is from a movie, and this gentleman who had vaccine probably could have sold it for $1 million a dose. He had a very limited supply of vaccine, and this is the way he advertised. And decisions were made as to who was going to get that vaccine, and oftentimes we find ourselves in that very same position with limited supplies of vaccines. But I'm going to give you an update on the status of the 2009 H1N1 vaccine from our state perspective. Currently, vaccine is being manufactured by 4 different companies in the United States. As vaccine becomes available, it's going to be provided free of charge to anyone who wants to receive the vaccine. Medical providers may charge an administrative fee. We'll take questions at the end. For vaccination, but to cover their costs of their nurse or their staff who has to vaccinate, but these costs will be covered by most healthcare plans. The Department of Public Health has enrolled interested providers, so medical providers in the community who are interested in administering vaccine through their practices went through a pre-registration process that took place earlier in September. Local health departments will work with town schools and other groups to determine the need for any mass vaccination clinics, and they will be planned as necessary. Vaccine is available to local health departments as well. There are priority groups for vaccination, and they've been developed and issued by an advisory committee on immunization practices, which is a committee at the Centers for Disease Control and Prevention that makes all kinds of recommendations on every type of vaccine that's available in this country. We want to emphasize that seasonal influenza vaccine is available, and it should be encouraged for everyone. There will be seasonal flu this year as well, and that's the best way to protect yourself from the flu. Priority groups are listed here, and it's important to say pregnant women are at the top of the list. There have been pregnant women hospitalized with H1N1. The last report I saw, there were close to 100 women hospitalized, and nearly a quarter of them died due to H1N1 or complications from H1N1. This is a very disturbing statistic. Caregivers and contacts of children less than 6 months of age are also encouraged to get immunized, and that's because infants can't be immunized. You can't at 6 months of age or less. So those people who surround those infants should be protected and shouldn't be bringing this influenza virus home to these little babies. Healthcare workers, EMS personnel with direct patient care contact are also on the list. Any persons aged 6 months to 24 years, this is the most impacted group that we saw countrywide with H1N1 this past April through July. And so they've also been designated. A lot of people like to refer to little kids as spreaders, and when you see the way influenza virus is spread, you can imagine that little children aren't really covering their cough or blowing and sneezing into tissues and washing their hands as much as they should be. So this is a target group as well. And persons 24 to 64 years of age at increased risk for flu complications. So if you have any of those underlying conditions, you are also on the list. A little bit about the vaccine. It's being produced by 4 different companies. These companies also produce the seasonal influenza vaccine, as well as a whole host of other vaccinations that are used in this country. They're using the same processes that they do for seasonal influenza vaccine to make this vaccine. Currently, our challenge at the department is that we do not know what type of vaccine will be coming into the state until that information is provided to us. And it's usually not provided to the state health department until a week before the shipments are actually being shipped. So for instance, we thought we would be able to vaccinate all the pregnant women who needed to be vaccinated because we thought we would be getting an intramuscular vaccine, and lo and behold, the first vaccine that's available is this live attenuated intranasal, the spray vaccine. It's only for people who are 2 to 49 years of age, who are healthy, and who are not pregnant. And so then our challenge was, how do we get it out to providers who need to give it to their patient population, and who do we give it to in those priority groups? So we had to then skip pregnant women for a few minutes and target other priority groups to get
And
the
that has
vaccine
the
to.
live virus in it.
It's a live attenuated intranasal virus. It's a
don't spread
weakened
it.
virus, an intranasal spray.
But it's live.
It's live but attenuated, which means it's weakened. It doesn't cause flu.
Okay.
Anyway, okay, and so other age, so you can see by the age distribution of the inactivated intramuscular vaccines that we have quite a challenge if we are to get the CSL vaccine that's only for 18 years of age or more, then again we have to target who that vaccine is going to be distributed to. The good news about all of this is that it's important to remember that adequate supplies of vaccine will be available to anyone who wants vaccine. We just need to give it time to flow through the pipeline. So anyone who wants to be vaccinated will be vaccinated, will have a vaccine. Anyone who doesn't want to be vaccinated doesn't have to be vaccinated. This is a press release that Governor Rell issued last Thursday announcing receipt of 20,000 intranasal doses available for children aged 2 to 4 years of age. This vaccine is also being shipped to hospitals within the state to immunize their staff, again, who are between the ages of 2 and 49 years of age and are healthy, have no underlying health conditions. And it's also being used to immunize people who might be caring for infants and who want the vaccine, for infants less than 6 months of age. We also established a flu hotline at the health department. The number is there. It's to provide any type of information to residents if they have any questions or concerns about the flu, both H1 or regular seasonal flu. I'll digress.